So yesterday we discussed about Bell's palsy. Okay. Today we will discuss an important disease that is trigeminal neuralgia. Trigeminal neuralgia. Because these are the important clinical cases, okay, where main number of patients are suffering. Okay, so that's the reason I am taking this uh, topic. So basically, facial Bell's palsy, in that facial nerve is affected, seventh nerve. Here in trigeminal neuralgia, the cranial nerve number five, fifth, that is trigeminal nerve, TN, is affected. So basically, what where the trigeminal nerve is situated? Let's see that first. Okay, you can see this image. Okay, so this is the one area where the trigeminal nerve is having multiple branches. One is ophthalmic branch, which supply eyeball. Second is maxillary branch, which supply upper part of the teeth. Okay, and lower branch, that is mandibular branch. Okay, you can see that this is the ophthalmic branch supplying area. This maxillary branch supplying area, and the third one is mandibular supplying branch area. Okay, so this is very important. So what are the functions? Okay, that are the we can see that what are the functions of trigeminal nerve, fifth cranial nerve. So basically it is a mixed nerve. What is mixed nerve? We already studied that the nerve which have both the sensation. It will take the sense from that from this area to the brain, and it also taking that the impulses from the brain to the area. Now we will call mixed nerve. So it has three branches: ophthalmic branch, maxillary branch, and mandibular branch. So in the ophthalmic branch, what it will give sense to the orbital structure. Here is the orbital structure. You all know that this is the orbital area, okay, and the nasal cavity and skin of forehead, upper eyelid, and some part of nose. So all this sensation or motor function are supplied by trigeminal nerve. So this is very important to have to remember this. Next is maxillary branch. So maxillary branch is lower eyelid, okay, upper lips and upper gums and teeth, palate, and some part of pharynx, okay, in the throat region. This is the maxillary branch. And the third branch is mandibular branch. Mandibular is lower gums, okay, and teeth, lower lips, lower palate, and some part of tongue. And for mastication, whatever muscles we needed for mastication for chewing, okay, the trigeminal nerve is supplied. So trigeminal nerve very very important. So yesterday we talked about facial nerve palsy, Bell's palsy, which supply somehow like trigeminal nerve. Okay, it's applied to the wrinkles to produce the wrinkles and eyebrow, eyelid, okay, and face muscles and tongue muscles. Okay, tongue, two-third tongue. But here, Most of the parts are supplied by trigeminal nerve. Okay, most of the part, uh, here I already told that ophthalmic division, maxillary division, and mandibular division. So these are the three divisions having deep connection with our face. Okay, which have deep connection with our face. So that's the reason this nerve is very, very important. So basically, what will happen to this nerve? Okay, this is the functional part of trigeminal nerve. Now we will discuss the medicine part of trigeminal nerve area. So mostly, this cause is unknown. Why this happened? But underlying diseases like diabetic, hypertension, or trauma, any accident, any uh, damage to the particular this area. Okay, this is frontal, this is temporal area damage, trauma, accident will or any infection. These are the five underlying causes, but main cause I don't know. But underlying causes may be diabetic, hypertension, trauma, accident, and infection, which trigger the trigeminal nerve to get affected, okay, and cause trigeminal neuralgia. Okay, so what are the symptoms? Basically, which branch is affected? So, uh, according to that branch, so if you think this is the trigeminal nerve, it has three branch: branch number one, branch number two, branch number three. This is ophthalmic branch. This is maxillary branch. Okay, and this is mandibular branch. So, which branch is affected? Or sometimes, if it is chronic, all the three branches affected. Sometimes two branches are affected. Sometimes only one branch is affected. Okay. So, if the ophthalmic branch is affected, so what are the symptoms? So, basically, the forehead, there is a pain in forehead area. So, basically, we have bilateral trigeminal nerve. This is the thing you have to important. We have to remember. So, if the right side branch number one is affected, we have foreskin or forehead pain. Okay, burning pain, mostly forehead burning pain will seen. Okay, and the pain inside the eyeball pain will call gradually will call eyeball pain. These are the two important symptoms when the ophthalmic branch is affected. Okay, if the branch number two is affected, maxillary branch, what will happen? It and in the ophthalmic branch, we'll able to see the pain in the nose area also, nasal pain or nasal running nose. You can see some patient will have. So nasal pain is also one of the one of the symptom. What is the symptoms in the maxillary branch if maxillary branch is affected? So basically the pain in upper jaw, teeth, gums, okay, and throat, some sort of problem in throat, okay, upper jaw problem in gums, teeth, okay. So these are the branch number two. Branch number three, lower jaw, lower area of the teeth. Effect comes in the lower jaw, teeth, okay, and the mastication muscles also So you're unable to hold the food or chew the food properly in one side. Okay. This is also symptom in facial nerve palsy also, because tongue is helping to chew the food and to roll the food from one side to another side. Okay. But how can you differentiate? If the teeth, gums are involved, then it is trigeminal neuralgia. The teeth and gums are not, not involved in facial nerve palsy, Bell's palsy. So this is how you can, uh, by the asking patient, by the examination. Okay, you have to tell the patient to chew the food. Okay, to hold the food. Okay, by giving a, this is the examination, nerve examination. You have to do in the patient. So then only you will get proper idea. Okay, so this is very important. Okay, so you have to know about these three branches and their symptoms. And the last thing is that how do you diagnose this? Mostly there is no any particular any test to check the damaged nerve, but you have to examination of fifth cranial nerve, okay, and as well as seventh cranial nerve. Okay, both examination is needed to differentiate Bell's palsy to the trigeminal neuralgia. Okay, this is thing, and sometimes they are, if the nerve is affecting from longer duration, is happening continuously. Okay, it become chronic condition. Okay, patient have numerous diseases, his past history. Based upon past history, you can advise the patient MRI brain, or sometimes you need ENMG. Okay, this is the nerve conducting test, or we will call NCT, nerve conducting test also, to see the examination. Or sometimes in the electrohomeopathy, what is the diagnosis? In my opinion, there is nutritional deficiency. Okay, because nerves are related to blood. Nerves are related to blood, sanguine temperament. So the nourishment to the nerves is not happening properly. So there's the reason the person is affected. So this is simple diagnosis. By trigeminal neuralgia is blood temperament disease. So the blood, we have three things: blood producing organs, okay, blood utilizing organs, blood purifying organs. So nerves are utilizing blood, means there is a no proper nourishment in the body. Due to that, the utilization is not happening. So why is utilizing not happening? Is the problem in the nerve itself, or the production is not there? So again, you have to check the CBP, or what are the nutritions required for nerve. Okay, so we need, what are the nutritions? We need nutritions daily requirement in daily, okay, required in daily life. So basically for nerves, okay, first is vitamin B12, very important, because the nerves having myelin sheath, axon, already we studied in anatomy and physiology, cell body, dendrites. Okay, so vitamin B12 is very essential for to improve the function of the nerve. Along with, we need all the vitamin B6, B3, okay, and we need calcium, okay, and as well as vitamin D3 is needed. Okay, these are the main important nutritions to see the nerves as healthy. So these vitamins are deficient in blood. So there's the reason the problem is there. So we have to check that the production as well as utilization. Okay, production and utilization. So if the infection is there, is purification, purely purification. You can go directly purification, and you have to purify whatever infection is there. You have to purify that. Okay, that's how we diagnose in electrohomeopathy. Okay, so let's discuss the treatment part in electrohomeopathy. So basically, uh, if I hear the basic idea, that is nutritional part. So we will treat the trigeminal neuralgia as a nutritional part, not as a pain part. Pain is a symptom which which is attention by the body. Okay, which is the attention needed by the body. Not a pain is any disease. Okay, pain is a attentional symptom which is giving the body, giving the hint to you, please take care of mine. Okay, it is a language of the body. Okay, so you need to try to understand that communication. So if you are taking painkillers, okay, mostly in the allopathy, or most of the people will take painkillers. Okay, what it will do, it will reduce the pain only for some times. Then again, the pain will increase. So, but some doctors will give multivitamins also. Okay, in trigeminal neuralgia, like vitamin B12, calcium. Already I told you, it will work for some time, some extent. Okay, if it is normal deficiency, okay, it will work, no issues. But it is most large amount of deficiency. Whenever you are using multivitamin, it will good. But if you quit, what will happen again? The symptoms will arise. Okay. So what we have to check here, we have to improve the metabolism. Metabolism means the nutrition, whatever you are taking, that it will reach to the body by proper amount, okay, and heal the problem. So basically, we have in the beginning we will take S1, and along with S1, because S1 is a metabolic remedy, universal remedy, and as well as digestive remedy, and along with you can use A3 as a multivitamin because of the temperamental and as a blood temperament, and B, due to the inflammation, blood is not reaching properly, circulation is not there. You can take S1 A3 B. Here it is as a proper nutrition, but here uh, nerve is affected now. So you have to improve the nerve functions also. So we have to take F1. Along with F1, we have to take S10, and F1WE is a wonderful remedy for all types of neuralgia, nervine. It is a nervine remedy. If you add S10, it will improve the metabolism more rapidly. Okay, so this is the basic remedy what we have to give in D5. Initially start with D5, along with if any symptoms happen to the patient, pain is there, to reduce the pain, you can add F1A3C5RE. Okay, in D5. Okay, this is you can take for pain. Other than that, the patient have other symptoms. You have to ask the how is diet, how is urination, how is stool. Okay, is there any issues? You have to add digestive remedies also. Like we have S10 L1WE is a very wonderful digestive remedy to improve the digestion of the body. Okay, and other than that, S10 C10W is also very wonderful remedy. Okay, and the second thing, if this problem is due to the infection. Till here, we discuss about nutritional issues or functional issue of the nerve. But if it is infective, viral infection is there, so then what you have to do? You have to improve the immunity. You have to fight with the with the infection. Okay. So what is the remedy for improving immunity? That is S1W or S1L1W. This is a wonderful immunity improving remedy. Okay. So this is how, if there is no infection, so it doesn't need S1L1W. Without that, you can go through that first two remedies. If it is pain, you have to add this. If any issues due to the digestive disorders because of the lack of proper intake of food, you have to have this remedy. So we covered all the three aspects, whatever possibility are there. But if it is diabetic hypertension, so you have to treat along with neuralgia with a hypertension treatment or diabetic treatment. So overall, diseases will cover and patient will gradually it will improve. Okay. So I think you understood this part about trigeminal neuralgia. Hope so. Any doubts? Kindly ask.